Hello everyone. In this particular session, I'll be discussing a very important topic in the pharmacology, that is drugs used in the treatment of the erectile dysfunction, and overall I'll be discussing what are the various options of the treatment for erectile dysfunction, because for this erectile dysfunction it is not only just the pharmacological treatment, and in those individuals who are refractory to medical management or who are intolerant to medical management, we also have the surgical options for the treatment of the erectile dysfunction. Now, first of all, you should understand what exactly is the definition of the erectile dysfunction, and at the same time you should understand the basic physiology behind the erection of the male genital organ and why does the erectile dysfunction occurs. So, if you see the definition of the erectile dysfunction, the definition is that it is the consistent inability to achieve and maintain an erection. Right? It is the consistent inability to maintain the erection and or to achieve the erection. Okay, so the definition is, it is the consistent inability to achieve or maintain an erection adequate, right? And this particular erection should be adequate for satisfactory sexual intercourse, right? Adequate for satisfactory sexual intercourse. Okay, so this is the definition of the erectile dysfunction. So in this, patients with erectile dysfunction, they will have either of these. They will have either inability to achieve the erection or they have inability to maintain the erection, which is required for satisfactory sexual intercourse. Now, the definition is very simple, but the condition is very traumatic and very difficult clinical scenario. Now, if you take the anatomy of the male genital organ, that is penis, the male genital organ, it contains the muscles like corpora cavernosum and as well as the corpora spongiosum. And along with this, so these muscles, they form the bulk of the male genital organ, that is corpora cavernosum and corpora spongiosum. Now, along with that, you also have the neuromuscular bundle or neurovascular bundle. And this neurovascular bundle, it has the supply of the parasympathetic nervous system and as well as sympathetic nervous system. And if you take the vascular bundle, it contains the dorsal artery and as well as deep dorsal venous plexus, and you also have the cavernous artery. So this will be the neurovascular bundle within the male genital organ. Now, for an individual to have a normal male sexual function, what are all required, right? So for an individual to have normal sexual function, right? For an individual to have a normal male sexual function, it requires an intact libido. Right? Requires an intact libido. Right? So the individual should have an intact sexual desire. Next is the individual should have adequate detumescence. So detumescence in the sense, the tension within the muscle, right? The bulk has to be maintained, right, during that particular sexual function. In order to have a normal sexual function, the detumescence has to be maintained. And third important thing is ability to achieve and maintain the penile erection. right, for normal sexual function, ability to achieve and maintain ability to maintain and achieve the erectile function or the penile erection. And finally, the individual has to undergo ejaculation, ejaculation. So these are required for normal male sexual function. Now we have discussed the neurovascular bundle, right? Neurological supply will be your parasympathetic nervous system and as well as the sympathetic nervous system. So if you take the parasympathetic nervous system, this is required for erection of the male genital organ, right? This is required for erection of erection of the male genital organ. So what is that particular parasympathetic nervous system, or what are those spinal nerves of the parasympathetic nervous system which are required for erection of the male genital organ? That is mainly the sacral nerves, that is S1 to 2, right? That is sacral spinal nerve 1 and as well as the sacral spinal nerve 2. So this parasympathetic nervous system will maintain the erection of the male genital organ, whereas if you take the sympathetic nervous system, right, the sympathetic nervous system, this is required for ejaculation, right? The sympathetic nervous system, this is required for ejaculation. And what will be that particular spinal nerves of sympathetic nervous system which will control the ejaculation is T11, T12, L1 and L2, right? T11, T12, L1 and as well as L2. So this sympathetic nervous system will control the ejaculation and as well as detumescence. Right, will maintain the ejaculation and as well as the detumescence. So this is about the nerve supply to the male genital organ for the sexual function. So if you see the physiology of erection, the penile erection is a neurovascular event, and this particular neurovascular event of erection, right, so this penile erection, it is a neurovascular event. Okay, so this neurovascular event, it is modulated by psychological factors and hormonal status. Right, it is maintained by the psychological factors and the hormonal status. Right, and the hormonal status. So these two are very important for the neurovascular event for the maintenance of the penile erection. Now once there is a sexual stimulation, there is increased flow of blood into the lacunar network, right? So you have a lacunar network within this male genital organ. So whenever there is sexual stimulation, there is increased flow of blood into the lacunar network, and there will be subsequent compression of the trabecular smooth muscle. This subsequent compression of the trabecular smooth muscle, it causes the closure of the emissary vein and accumulation of the blood in the corpora, and the corpora becomes non-compressible and blood cannot escape. So basically you have to remember that whenever there is sexual stimulation, in order to have the penile erection, there should be increased blood flow into the male genital organ, and in order to maintain that particular detumescence, the blood which has entered into the male genital organ should not escape out, and that will maintain the detumescence. right? That will maintain the detumescence. Now, after having said the brief basic introduction, now let me discuss the nerve impulse which will be causing the erection, right? And what are those neurotransmitters which play an important role in the maintenance of the erection? I'll discuss that in detail. So before that, a short recap. So the definition of the erectile dysfunction is that it is the disorder where the individual will have consistent inability to achieve or to maintain the erection which is adequate for satisfactory sexual intercourse. And for normal sexual function, we require an intact libido, detumescence, erectile function, and as well as the ejaculation. And the parasympathetic nervous system, it is required for erection of the male genital organ, that is sacral spinal nerve S1 and as well as S2. Whereas sympathetic nervous system, it is required for ejaculation and as well as detumescence, that is T11, T12, L1 and as well as L2. And if you see the neurovascular, as such the penile erection is a neurovascular event which requires an adequate psychological factors and as well as the hormonal status. And now let me discuss what are the neurotransmitters which are required for the maintenance of the penile erection. So now let me discuss the basic physiology of erection, right? What are the nerve impulses like and what are these neurotransmitters? So whenever there is sexual stimulation, the nerve impulses, they cause the release of the neurotransmitters, right? The nerve impulses. So whenever there is sexual stimulation, nerve impulses, they cause right, they cause the release of the neurotransmitter. And what is that particular neurotransmitter which is being released? That is nitric oxide. Right, the neurotransmitter which is being released is the nitric oxide. So this nitric oxide, it is released from the cavernous nerve terminals. And this nitric oxide which is released from cavernous nerve terminals, this nitric oxide diffuses into the cavernous smooth muscles, right? This nitric oxide diffuses into cavernosal smooth muscle cells, right? And this nitric oxide, right, this nitric oxide which is diffused, right, which is diffused into cavernosal smooth muscle cells, this nitric oxide activates the guanylate cyclase, right? This nitric oxide will activate the guanylate cyclase. Now what this guanylate cyclase does? This guanylate cyclase, it converts GTP to cyclic GMP. Right, this guanylate cyclase, it converts the GTP, that is guanosine triphosphate, to cyclic guanosine monophosphate. And this cyclic guanosine monophosphate which is being released, this will result in smooth muscle relaxation. Right, this will result in the smooth muscle relaxation within the arteries and as well as the arterioles. Right, the cyclic GMP whichever is released will cause the smooth muscle relaxation within the arteries and as well as arterioles supplying the erectile tissue. Right, this will cause the smooth muscle relaxation of arteries and arterioles supplying the erectile tissue. And once there is smooth muscle relaxation, right, once there is smooth muscle relaxation of the arteries and arterioles supplying the erectile tissue, this will cause several fold increase in the blood flow. Right, this will cause several fold increase in the blood flow. So this is the basic physiology of erection. So whenever there is sexual stimulation, nerve impulses, they cause the release of the nitric oxide from the cavernous nerve terminals. And this nitric oxide, it diffuses into the cavernosal smooth muscle, right, that is the corpora cavernosa and corpora spongiosum. And this nitric oxide, it activates the guanylate cyclase. And this guanylate cyclase, it is the enzyme which is required for the conversion of GTP to cyclic GMP. And this increased cyclic GMP will cause the relaxation of the smooth muscles, right, will cause the relaxation of the smooth muscles in the arteries and arterioles supplying the erectile tissue. And once there is increase in the blood flow to the erectile tissue, right, so once there is smooth muscle relaxation of arteries and arterioles supplying the erectile tissue, there will be several fold increase in the blood flow to that particular erectile tissue, right, several fold blood flow in the erectile tissue. Now, not only there is increase in the blood flow to the erectile tissue, at the same time there is relaxation of the trabecular smooth muscles, right, we have trabecular smooth muscles within the male genital organ. At the same time there is relaxation of trabecular smooth muscle, increases the compliance of the sinusoids which are facilitating the rapid filling of the blood, right, which are facilitating the rapid filling of the blood. Now these particular events, so basically now for the erection to occur, there should be increase in your cyclic GMP levels, right, and there should be release of this guanylate cyclase, and there should be adequate amount of GTP. So these three important chemical substances are very much required for the erection to occur, and the other important thing is nitric oxide, right, the other important thing is nitric oxide. So this particular sequence or the reaction is very important for you to understand the drugs used in the treatment of the erectile dysfunction. Okay, so if you see the physiology now, all these events, right, all these events, they trap the blood within the corpora cavernosa, right, so all these events, they trap the blood in right, they trap the blood in the corpora cavernosa and they raise the male genital organ from the dependent position to the erect position. So they trap the blood in the corpora cavernosa and they raise the male genital organ from dependent position to a state of erection, right, from dependent position to a stage of the erection. And at the time of full erection, right, at the time of full erection, what is the intracavernous pressure, right? So at the time of full erection, if you observe, right, if you observe the intracavernous pressure, it is around 100 millimeters of mercury, right, if you observe the intracavernous pressure, it is around 100 millimeters of mercury, right. So if you see the normal pathway to erection, first and foremost the sexual impulse, that will cause the release of the neurotransmitter, right, wherein there will be release of nitric oxide first, and this nitric oxide, by increasing the cyclic GMP levels, it will cause the smooth muscle relaxation within the arteries and arterioles supplying the erectile tissue, right, and that will increase, that increased cyclic GMP will increase the blood flow to the erectile tissue. Once there is increased blood flow to the erectile tissue, that will cause the erection of the male genital organ. So this particular reaction or this particular sequence is very important for you to remember the drugs used in the treatment of the erectile dysfunction. Now let me discuss what are the types of erectile dysfunction. Then followed by that, I will discuss what are all the various drugs required for the treatment of erectile dysfunction. So let me discuss what are the types of erectile dysfunction. So erectile dysfunction, we have primary and as well as secondary, right, primary and as well as secondary. Now what do you understand by this term, the primary erectile dysfunction? Primary means present from the first attempt at the intercourse, right, it is present from right, this is present from the first attempt at intercourse. That is what is your primary erectile dysfunction. Right, present from first attempt at intercourse. Or it may be secondary. What do you understand by secondary? Secondary is that in which person develops erectile dysfunction after a period of normal function. Right, so here the person develops erectile dysfunction after a period of normal function. So that is what you understand by this word, right, that is what you understand by this word, the secondary erectile dysfunction. Now we will discuss the etiology of the erectile dysfunction after the treatment, like we have psychological causes for erectile dysfunction, right, vasculogenic, that is arterial or cavernosal causes for erectile dysfunction, and very important thing is the systemic diseases and aging like diabetes mellitus, chronic renal failure. Then we have neurological causes for the development of erectile dysfunction and hormonal causes for erectile dysfunction, and there are certain drugs which will induce the erectile dysfunction, right. All these I will discuss once I discuss the treatment of the erectile dysfunction. Now, if you take the treatment of erectile dysfunction, first you need to know the drugs. What are the drugs which are required for the treatment of erectile dysfunction? Okay, so in the treatment of erectile dysfunction, okay, but before the drugs also we have the psychosexual therapy, right, that is general counseling. Okay, so first we have certain general measures for the treatment of the erectile dysfunction, then psychosexual therapy, right, and third we have drug therapy, that is medical management, right, then we have the vacuum devices, right, then we have vacuum devices, and followed by that finally we have surgical treatment, right, followed by that finally we have surgical treatment. So these are the treatment strategies for the erectile dysfunction. So if you take the algorithm also, the first line management will be lifestyle changes, and as well as the hormonal issues, right? That means what? This will be the first line management, okay? That is lifestyle changes and as well as the hormone issues. And second line management will be the oral medication, that is your drug therapy and as well as the counseling. And third line management will be the penile injections. So after the drug therapy, like the options like what we have is penile injections. I'll tell you what are those, right? So penile injections and the vacuum devices. So this will be the third line therapy. And fourth line therapy will be implants. Right, the fourth line therapy will be implants and vascular surgeries. Fourth line treatment will be implants and vascular surgeries. So this is the algorithm for the treatment of erectile dysfunction. First line therapy will be lifestyle changes and hormonal issues have to be taken into the consideration. Second line management will be drug therapy and counseling. Third line management will be penile injection and vacuum devices. And fourth line management will be implants and vascular surgeries. Now, let me discuss what are those general measures and what are those psychosexual therapies. All that let me take into consideration, and after having discussed about the general measures and psychosexual therapies, then I will discuss the drugs which are used in the treatment of the erectile dysfunction. So let me discuss the etiology of the erectile dysfunction. So if you see the etiology of erectile dysfunction, first and foremost, the very important etiology is the psychogenic causes. Right, the very important etiology is the psychogenic. And within this particular psychogenic causes, the very important is performance anxiety. So in order to reduce this performance anxiety, the individual requires an adequate psychosocial counseling which will reduce this performance anxiety and where the erectile dysfunction can be reduced, or the clinical problem of erectile dysfunction can be treated by adequate counseling. And another important psychological or psychogenic cause include the relationship problems or relationship difficulties. So even for this particular relationship difficulties causing erectile dysfunction, this also requires adequate psychological counseling which can improve the erectile dysfunction. And third important thing is loss of attraction to the partner. Right, loss of attraction to the partner. And next important thing, depression and anxiety disorders. Right, depression and anxiety disorder, then followed by that fatigue, then stress. Right, so these are the psychogenic causes for the development of the erectile dysfunction. And lastly, marital discord. Now, after having discussed about the psychogenic causes for erectile dysfunction, let me tell you what are the vasculogenic causes. Right, let me discuss what are the vasculogenic causes for the erectile dysfunction. The vasculogenic causes, like we have arterial or the cavernosal. And this vasculogenic causes includes right, it includes atherosclerosis, then followed by that hypertension, and then trauma. Right, hypertension and trauma. So these are the vasculogenic causes for the development of the erectile dysfunction. Then we have systemic diseases and aging. Right, systemic diseases and as well as the aging. So if you take this systemic diseases and as well as aging, first and foremost, old age is one of the etiology which can cause the erectile dysfunction because of impairment of the strength within the individual. Then diabetes mellitus, chronic renal failure and coronary artery disease. So these are the systemic diseases which can cause the erectile dysfunction. Then followed by that, the neurogenic causes. Right, followed by that, the neurogenic causes for erectile dysfunction. So the neurogenic causes include stroke or the Alzheimer's disease, right, then followed by that, spinal cord injury, next radical pelvic surgery, then followed by that diabetic neuropathy, So these are the neurogenic causes for the development of the erectile dysfunction. And lastly, the hormonal causes. And these hormonal causes include hypogonadism and hyperprolactinemia. Hypogonadism and hypogonadism and as well as the hyperprolactinemia. So these are the etiologies which will cause the erectile dysfunction. And followed by that, the very important group of drugs, we have a very important etiology, that is drug induced. Now let me discuss the drug induced causes for erectile dysfunction. So before that, so if you take the psychogenic causes, that includes performance anxiety, relationship difficulties, loss of attraction, depression and anxiety disorders, fatigue, stress and marital discord. And vasculogenic causes include atherosclerosis, hypertension and then trauma. Then systemic diseases and aging, that includes old age, diabetes mellitus, chronic renal failure and coronary artery disease. And the neurogenic causes are stroke or Alzheimer's disease, spinal cord injury, radical pelvic surgery and diabetic neuropathy. And hormonal etiologies include hypogonadism and as well as the hyperprolactinemia. Then followed by that, lastly, we have drugs which will cause the erectile dysfunction, and let me discuss what are all those drugs which will cause the erectile dysfunction.